Hello everyone. So in this video we are going to talk about breastfeeding. We will start by talking about breast milk. Breast milk is considered complete food for the baby. It is the ideal milk or the milk. Okay. This is because it contains all the nutrients that are required for normal growth and development of a baby up till 6 months of age. That is why we say to go for exclusive breastfeeding for 6 months of age. When do we start? We start as soon as possible and within 1 hour in case of cesarean section. Why so much importance of breast milk is, just consider this fact that using exclusive breastfeeding for 6 months of age reduces under 5 mortality rate by 13%. We have one more data. Using breast milk reduces the chances of death due to diarrhea by 14 times and due to respiratory failure by 4 times. Okay, just think, by giving an exclusive breastfeed which is so easily available, the mortality rate reduces by such a high percentage. Going on to benefits of the breast milk, we'll start by discussing each component of the breast milk and the benefits associated with it. Talking about carbohydrate, the carbohydrate in breast milk is rich in lactose. Okay, this lactose itself help in the absorption of the calcium and promotes the growth of lactobacilli. It converts into glucose and galactose, and this galactocerebrosidase will help in CNS myelination. The protein content is low in the breast milk compared to a cow milk. It is around 0.9 to 1.1 gram per deciliter compared to cow milk, which is around 3 gram per deciliter. But the important point is this protein is rich in lactalbumin and lactglobulin that is easily digestible by infant. Okay, it also is rich in cysteine and taurine that is going to help in neuromodulation and neurotranslation in our brain and helps in the brain development. The fat content consists of PUFA and omega-2 and omega-6 fatty acid. Here PUFA again is going to help in myelination, and omega-2 and omega-6 fatty acid are going to form prostaglandin and cholesterols. The breast milk also contains vitamins and minerals. These vitamins are fat-soluble vitamins. Minerals include a small quantity of iron. The water content is around 88%. That is why breastfeeding means exclusive breastfeeding, not even water in the initial months. Immunity is also produced by breast milk. The breast milk is considered first vaccine for the baby too. Okay, it is rich in secretory IgA and bifidus factor. The epidermal growth factor that is present in the breast milk reduces the intestinal allergies and the infections later on in the lives. The lipases present in breast milk help in digestion of the fat which is itself present in the breast milk. It reduces, okay, when the baby is breastfeeding, it reduces the chances of orthodontic problems in the baby. And because of, we already studied glucose, galactose which help in CNS myelination, cysteine and taurine, and PUFA help in myelination. So a breastfed baby will have an higher IQ. Are there any benefits of breastfeeding in mother? Yes, there are. It helps in uterine involution following the pregnancy. It also causes lactational amenorrhea by negative feedback on the HPO axis, and this is proven by many studies conducted, as mentioned in the Park Book of Preventive and Social Medicine. Breastfeeding the baby for after pregnancy inhibits the excess, and there is no need for contraceptive in the next initial 6 months. Okay, it also reduces chances of postpartum hemorrhage and decreases the risk of ovarian and breast cancer. Let's talk about some types of breast milk. Okay, we'll start by talking about a milk that is produced when the baby is born before the 37 weeks, sorry. So this baby is the preterm baby, and the milk produced so is the preterm milk, because the baby needs some more nutrition like iron, because his iron stores will be low. So there will be increased protein content, sodium content, iron content, immunoglobulin, and calorie content in a preterm milk. Talking about the initial milk, that is the milk produced from birth to the initial 3 and 4 days, is known as colostrum. Okay, this colostrum is very important. Okay, it is less in amount, it is thick and yellow in appearance, but is rich in antibodies and secretory immunoglobulins, and it is rich in the fat soluble vitamin, the vitamin A, vitamin D, vitamin E, and vitamin K. After the initial 3 to 4 days after birth, the the milk undergoes transition. What transition? The protein content and immunoglobulin content start to reduce in the milk, breast milk, and the fat and the sugar content starts to increase. This is the transition milk. After 2 weeks, the breast starts to produce mature milk. This mature milk is thinner and watery but has optimum nutrition for a baby to be exclusively fed up till 6 months of age. The mature milk has two parts. The first one is fore milk, that is produced in initial period of the breastfeeding. It is watery and helps in relieving the baby's thirst. The hind milk is thicker and is rich in calorie and provides energy to the baby and is going to fill the satiety of the baby. That is why we advise the baby to complete one breast before emptying one breast from the of the milk before initiating breastfeeding from the other breast. Okay, this will help the baby in getting both hind and the fore milk. So these were some bits about the breast milk. We will study further.